Hello everyone, myself Dr. Uttam Kumar Lenka. I am a dermatologist from Kolkata. Today I shall discuss briefly regarding the fungal infection. Fungal infections are the most common type of skin diseases nowadays. Almost 60 to 70% of skin disease nowadays is a fungal infection. So how to recognize this is a fungal infection? Whenever you develop a circular or round rash over the body part, first suspect it may be a fungal infection. So whenever you suspect it is a fungal infection, never use the over-the-counter medicines or don't self-medicate yourself. Always visit a dermatologist, confirm the diagnosis, because the fungal infection at different site may require different medicine. Like if you develop fungal infection of the face, it may take more time and it may need more medication, more dose than the infection of the hand or the folds. If you develop fungal infection of the nail, it is called tinea unguium. This needs more medication, the prolonged medication, because these nails are the dead structures. They don't have the blood supply, and it takes times to heal. So you have to take medication for the long time. So these fungal infections are mostly superficial fungal infections. They are classified differently according to site of the body affected. Like if the head of the patient is affected by fungus, it is called tinea capitis. If the folds, like the axillary fold, the mammary fold, the crural lesions, these are affected, this is called tinea cruris. If the whole body part is affected, this is called tinea corporis. How to prevent these infections and why these fungal infections are more nowadays? The fungal infections are more nowadays due to hot and humid climate, global warming, and use of tight fitting dresses like jeans, and busy lifestyles. What happens nowadays? Patient or any person, public, they go to bathroom, they take bath, and without drying the body, they immediately wear the inner wears, which leads to formation of a humid, hot climate around the body folds. And at this hot, humid atmosphere, the fungus, they grows faster, they rapidly multiply, and which leads to fungal infections. Take the medications completely. Don't discontinue the medicines without dermatologist prescription or advice, because whenever you take the medications, whenever you apply the medicine, the fungal infection disappear within 7 to 10 days. That is the visible fungal infection, they goes out, but some fungus, they remain inside the skin, which leads to recurrence. The patient develop the rash again and again. That is the most common cause. And another reason is now the fungus have become more resistant, for which the dose should be adjusted according to the body weight, according to the age and sex. If they are obese, they need to decrease the body weight. If they are diabetic, the dose is also adjusted. If they are cardiac patient or heart patients, the dose is also changed. So never use your friend's prescription or family member prescription. And if all of your family members are affected, try to get treatment, all of them at the same time. Because if you are affected by fungal infection and your family member are affected by fungal infection, and what you are thinking that let me get the treatment first. If I get relief, then my family member will come to you. But that is not correct, because if you are getting the treatment and you get relief from the fungal infection, what happens again? You are staying with your family members, and these fungal infections are contagious. They spread from one person to another. They spread through the fomites. Fomites means like towels, bed sheets, combs. So your family members are affected. You get the treatment. You are already cured of the disease. Now what will happen? You again will get some infection from your family members, and the infection will again appear. So always try to get treatment for the whole family if the whole family is affected,